Okay, it is high noon, and just to be respectful of everybody's time, we do have a bit of an agenda today, so we will go ahead and get started. First and foremost, obviously, happy Halloween. Thank you so much for joining us in our October Respiratory Department meeting. So just a quick reflection. This is a quote by Vincent van Gogh. If you hear a voice within you say you cannot paint, then by all means paint, and that voice will be silenced. I think that this is something that we can apply in all of our collective daily lives. All right. Agenda. All right. You know it. It's coming. Raffle selections. Obviously, we're going to take care of that first. Super important. Then accounting, of course, one of our hanging topics. Just give us a little bit of a touch point of where the department is. RT procedure count, a little bit more of an explanation of what was already mentioned in our Tiger chat. This is a company-wide respiratory therapy initiative that is aimed to try to better understand the actual work that RT departments do across the ministry. So we'll go over that in a little bit more detail. RT equipment, just a hanging slide there. Team, some just reiterating some expectations. Employee satisfaction, we will try to solicit some opinions and some ideas from one of the questions asked in the most recent employee satisfaction survey. Education, just a brief touch point on that again. Unit-based practice council, Carrie is not available. I don't see Danielle on the call. I know Carrie will be on this evening. So we will get an update from the Unit-Based Practice Council then. Scanning scores, just a touch point there.
Respiratory rates. I'm just in there still trying to mouse up everything.
Positions, we will be having an open position here momentarily. We'll go over again some productivity, just kind of giving you another update as to where we're at with our current billing practices. Spoiler alert, everything is still the way we have been doing it for now. Kudos, we'll go over what was on the Kudo board and then open forum and questions. Okay, so without further ado, we'll get right into it with the raffle. So first one is for the Bluetooth speaker. And I gotta tell you, this one is there's only one ticket in here, and it's Camille. So Camille, you get the Bluetooth speaker. No competition whatsoever. So there you go. All right, moving on is the Porter ceramic cup. Joanna. Joanna gets the selected for these Porter ceramic cup. Awesome job, Joanna. Next one up is the 16.9 ounce stainless steel container, steel cup. We got some more people that have gotten to the waiting room. I am admitting them. Okay. For the steel cup, Stephanie De La Cruz. Congrats, Stephanie. Next one is the Yeti. A lot of people wanted the Yeti, it looks like. Ina. Ina got the Yeti. Good job, Ina. All right, last but certainly not least, the wireless earbuds. Wireless earbuds go to Matt. Congratulations, Matt, and congratulations to everybody that participated. And again, thank you all for making RT Week so successful. The prizes will be handed out as soon as possible. I think we have a couple of RTs that have won that are on today. I'll be handing out those prizes to them and then following up with the rest that are on currently. So thank you very much, and here's to another year. All right. Moving on. Um, Productivity year to date is still good. Obviously, our goals are to have productivity at 100% or higher. We're currently at 111.5. We are trending down, and that is not due to anything besides our census going down over the course of the last maybe 4 to 6 weeks. We've really taken a pretty significant hit. You guys are flexing as appropriate, which is definitely helpful. But bottom line, if we don't have the patients, we don't have the orders, we just don't have we can't make the productivity. But as it stands right now, our year to date is still fine, so we're still good. Over time, our goal is 2% or less. We're currently at 1.35. So again, that's being managed very well. So keep up the good work. Hopefully we can get some more patients. It looks like our census has gone up already, so this is a good sign. Okay, so this is what I had mentioned in our Tiger Connect the other day. Basically, what the RTs in this organization across the ministry have been talking about quite a bit for years now, honestly, is trying to come up with a way in which we can be counted or accounted for our time for the various procedures that we do. Because certainly we do a lot that either aren't counted uh, from a productive standpoint or a billable standpoint. This is seen in the amount of RVUs that are associated with some of the tasks that we currently do. Um, Obviously, that's not right. It's not an accurate representation of what it is that we do day in and day out. And it's ultimately it gets us in the way of where we should be staffing appropriately for the tasks that are expected of us to be completed on any given shift. So after several months of just kind of back and forth with a lot of hospital leaders, this is basically what has been born out of those talks. What we're trying to do is collect some data over the course of the month. The month that we're going to be collecting this data is November. So this initiative is going to begin November 1st or tomorrow. And what the ask is, and it's not just for our department, but it's all RT departments, again, across the organization, is that for every RT, for every shift for the month of November, that this page be taken with you throughout your day. And it demarcates basically everything that we do that is not necessarily chargeable, billable, either from a financial standpoint or a productive standpoint. The intent is to put a hash mark for every one of these instances that you have throughout your shift. And then at the end of your shift, place this in the office box. I'll be doing the data entry, and then this will go back to the National RT Council with hopefully some further robust conversations with the corporate leaders, senior leaders, to basically come to the table and give us some more accounting of our time, so that they can fully understand what all it is that you guys do day in and day out that isn't necessarily counted currently. So this is hugely important. It's hugely important for all RTs in this organization, but ultimately it relies on the participation of you all collectively. So with that said, there is these forms are already available in the department. They are in a binder on our table. So my ask is that effective tomorrow on day shift, that these forms be handed out to all RTs, and that for both days and nights, that you fill them out as accurately as possible at the end of your shift, place them in the office box, and I will take care of the rest. What ultimately comes of this time will tell. I know that they're going to take some time to really kind of sift through the data, aggregate it, and then have further conversations with the appropriate stakeholders. But ultimately, whatever comes of the discussions, I will obviously bring back here to you all. It's quite a big initiative, and I'll pause for any questions that anybody on the call might have about it that I can answer.
How long did you say we're going to be keeping keeping track of this for?
Just the month of November.
Okay.
Yeah. So the list is pretty comprehensive, but what was brought to my attention earlier this morning is that there may be something that we uniquely do here at Woodland that isn't explicitly listed on this sheet, that isn't like a statistical charge or a billable charge. If that's the case, there's a backside to it that is completely blank. If you find something that is applicable to this or to your daily shift, just write it in, and I'll track that as well. Okay, moving on. RT equipment, just a brief touch point here again, like we do every month. As you guys may or may not be aware of yet, we are currently within our TJC window for inspections. I believe it is now through March of next year. I could be wrong on the exact dates, but we are definitely within the window now. And what you have collectively been doing up to this point is fantastic. Just keep up the good work. Cleaning, throwing away the circuitry and the equipment that we have. Leslie has raised her hand. Yes, Leslie.
I didn't mean to interrupt you.
Oh, no,
You could have
please.
finished. I have one question since we're talking about joint commission.
Yes,
The respiratory supplies in the ED in that cabinet, who checks those
we do.
for expiration dates?
We keep an eye on that as well as materials management. Materials management does the stocking primarily. They'll stock the fresh product in the back, have the old product up front. But both our RTs, our shift leads, are looking at that as well as materials management.
And how often is it checked?
It's almost every shift.
Oh, that's a lot of stuff.
It's not. I mean, not really. It's the same as the equipment that's up in our fourth floor. It's the same as the equipment that's in Family Birth Center. That's our RT specific. Yeah.
Okay, thank you.
Yeah. Yeah, the RTs do a phenomenal job of auditing that, and I think recently we've found I can't remember what, but something came up that we is our Bronc cart, I think, that we found that was outdated, and we isolated it and secured it and got rid of it. So anyway, all that said, just keep doing what you're doing. Clean, bag tag, plug in as applicable. Just a little bit of a touch point and a reiteration with regards to infection prevention and infection control. Just so that you guys are aware, we have audits that happen all the time from either leaders or nurses. They're always watching us perform appropriate hand hygiene and donning and doffing of appropriate PPE, depending on the types of rooms that we're going into. just as a reminder, if your gloves are intended to be used for patient care, and patient care only. So as an example, if you are gelling in, putting gloves on, seeing a patient, and for whatever reason you have to leave the room, leave the area, leave the patient to go outside of the room, the your gloves need to come off. You need to gel out, and then when you go back in the room, you need to gel back in, and you need to don a new pair of gloves. I know this is redundant, but just as a point of reference, it is something that comes up across various departments. So just want to touch base on that. All right. Team, again, another hanging slide that we talk about every month. Time cards are your responsibility ultimately. It's when we're at the end of the pay period, even during the pay period, it is collectively on you to ensure that the time that's recorded is an accurate representation of what you have done. So please remember to swipe in or use the quick badge feature and then sign off at the end of the pay period, ensuring that you are being paid correctly for the hours worked. All right, employee satisfaction, another My Voice question that came back relatively low. So we'll see if we can kind of brainstorm or solicit some ideas as to why this came up. So this question is the amount of job stress I feel is reasonable. So all the questions, all the data that I get on the back end from the employee satisfaction survey generally are all more or less high ranking. So, I specifically seek out the questions that are lower relative to the rest of them. So with this said, this question came up as one of the lower ones. So for anybody on the call, working in healthcare obviously is stressful, period. But what I try to do, at least from my vantage point, my seat, is to give you the tools, education, everything that you need in order to meet that moment as easily as possible. Certainly, there are extenuating circumstances. Certainly, there is high stakes in some of the actions and events that we're a part of. Those, are unavoidable. But I guess I'll leave it, open it up to those who are on the call who may want to comment if there's anything else that I could provide, or if this is more generally healthcare as a whole. Please don't all talk at once. I one at a time. Well,
Maybe they're on mute.
maybe they are on mute.
That's what everybody says. Maybe they're on mute.
I don't know why that's scored low, to be honest. I think there are days that are stressful, but I think for the most part, we work really well together. We help each other out. I wouldn't say our workloads are, overly stressful. Maybe sometimes we have stressful patients, but again, like you said, that's healthcare. So I don't know.
I wouldn't say that the work that we do is any stress that we're not used to. I would think that if somebody put that, it's probably more on the back end where, like, we have stressful situations come up with changes to policies, changes to the fact that we have to prove our productivity in a way that isn't really, manageable, if that makes sense. We've had a lot of changes the last couple of years as far as the way that we do things, and maybe that's why people are saying it's stressful. It's not necessarily our work, but how we have to prove our work, or scheduling, what's gone on in the clinic and things like that. Maybe that has something to do with it.
Yeah, that's a really good point. There has been a colossal amount of changes that have I mean, there's been changes in the respiratory leadership, there's been changes in senior leadership, there's been new asks, especially this year, that not just affect respiratory therapy, but the facility and the organization at large. Um, and that is stressful. There's no getting around it. For me personally, these are things that I'm tasked with trying to socialize as best as I can. Same as Leslie, same as all leaders here. And having an idea of the whys behind it sometimes is helpful. But to your point, Joanna, at the end of the day, it's a lot of change. We can't not move with our mandates and expectations, but at the very least, if we are apprised of what is being asked of us, that's the tools that we have available. And obviously, I do the best that I can to get that information out to the group. But outside of that, what would you say I guess, in other words, how would how would senior leadership or executive team leadership help with this? Is it just a messaging, or is it just that it is a lot happening seemingly all at once?
I don't know if there is anything that you can do. I mean, all kind of stuck in following whatever guidelines are coming out. I think that, maybe with this new system in place, maybe if they're actually taking into account with like our productivity, what we're actually doing, and not us trying to think of ways to prove our work without, being fraudulent, if that makes sense. I think that you have a lot of people making decisions that don't actually care for people in the same way that we do. So we're just numbers to them. And I think that's come out more recently, more often. And that's stressful because we're just trying to do our jobs. And I think that there's no way to really get around it, unfortunately. It's just part of the system at this point. But as far as caring for people, I think that stress is just something that we're used to and we've accepted going into this field. I don't think that that's something that I wouldn't think that that pertains to this question. I think it's everything above that is probably stressful to people.
Yeah, no, that makes sense. Leslie, I'm not sure if you would like to chime in. There certainly has been a lot of changes in healthcare, and you have the advantage of having interacted and interfaced with a lot of different healthcare organizations. To Joanna's point, or more broadly to this question, what would you say?
So in my experience, things are always changing, and I think we all realize that, right? Healthcare always changes. If it's not productivity, it is something else. It is always something. I would say that with productivity, organizations are challenged. It's not that, and I know sometimes it feels like we don't care about the people, we just care about the numbers. It's not that, from my perspective. It's not that we care about one over the other. It's that we have to care about all of it to remain financially viable. Unfortunately, it is still a business. And so you still have to treat it like a business. Just like I don't know if any of you own your own business, a small business, or have in the past, or whatever. But just like with any other business, you have to make sure that you put things in place so that you can stay around and continue to provide the service. Productivity isn't meant to capture every single thing you do. I don't agree with that, but that's just how it is. It's not meant to capture every single thing you do. Just like you all, nursing, literally every department had some cuts for this fiscal year. There is no department where productivity captures every single thing you do. And so, it is on us to explain that in a way that makes sense to non-clinical people, which is really difficult. It's often hard for clinical people to understand the finance piece of it because it's not the same language. It's a different language altogether. So one of the things that we work on every week, all of the leaders, is to figure out how we explain the other stuff that we do that is not accounted for in productivity already. And then we go from there. It's not something that you can't not think about. You have to. That's just business, unfortunately.
Yeah, and I didn't say that just to bring up the whole productivity thing, because I realize that. I'm just trying to answer your question about stress. It's one of those things where you ask the question why people are stressed out,
Right.
or they feel unheard, or they're upset with management, because those are questions that we get asked all the time.
Yeah.
And unfortunately, there's no real answer to it. It's just like, well, maybe it has something to do with this,
Yeah.
and there's not really any way to get around it. It's just what it is.
Yeah. No, you're right. And I hate that. I hate when I have to say it is what it is. But you're right. It is exactly that. It's just a matter of how, and I get that it's stressful. It's stressful for us too. So I know if I'm stressed about something, you all are really stressed about it. Because you are trying to help us be fiscally responsible, but you're also trying to take care of the patient, and the patient comes first. I mean, you all come first, honestly, in my opinion, and then the patients. But regardless, we're here to provide a service. And I know that you all get it. I know that you understand. You all probably get it and understand better than a lot of the departments, honestly. You all, and I've said this before, you all are a very high functioning department. So I have no doubt that you all understand that. I don't know how to help with that. And I don't know if there is anything that I can do to help with it.
For what it's worth, I mean, I think I've mentioned this in department meetings before. I have done my best to align with other facilities as a means to ensure that everything that we can bill for, we're billing for appropriately. And to that end, it has helped on the back end tremendously. We, in the beginning of the fiscal year, were struggling, quite frankly. And with that kind of change in practice, change in billing practice, we have come out of that significantly. And to this day, year to date, our productivity is still above 100%. So, it's on me, and reaching out to my direct leaders and to leaders across our service area to come up with novel ideas to navigate these difficult waters and these changing times. But it is a departure from the norm, and as Leslie said, that is part and parcel with healthcare. It's part and parcel with life, truly. So I guess what I will pledge to you, which you likely already know, is that I'm never going to stop fighting for the department, fighting for what it is that we do, and to maintain the high level of care that we have consistently provided our community. So, for whatever it's worth. Anybody else input about job stress? Reasonable, not reasonable?
Are there things outside of productivity that you feel like I could help with?
Yeah, to Joanna's, you're already helping. We already have had discussions and have meetings lined up, and that it involves the clinic. So yeah. Yeah. So. Okay, moving on. Hospital Skills Fair, Clinical Skills Day, there are 2 months left. I believe the overwhelming amount of RT staff has already completed what they needed to. I think there's a few that are still pending, but they are scheduled, so we should have 100% compliance by December. So very happy about that. Currently, there is a lot of discussion going on in the background of what Skills Day is going to look like in the calendar year of 2025. To my knowledge, nothing has been set in stone as of yet, but something happened. Leslie has her finger up.
It's not etched in stone yet, but we're preparing the stone for the etching.
Perfect.
So what it is likely going to be, education said that they would have a plan to me, a written plan to me by the end of the year, which I think will be fantastic. Because I want to look at all of the education that we provide in services, whatever it is. So education would like to develop a plan for how we handle education here, from new hire orientation to ongoing yearly. We have a lot of educational needs in some of our departments, and they need attention, more attention than what we've been able to give, because we do monthly skills fair. So we're going to go back to how we did skills fair, I guess, some years back, where we hold, I don't know, 4 to 6, I don't know what it's going to look like, skills days in, like, say October. I'm making it up. I'm thinking it's going to be October. So we would do all of the skills fairs in October, and we would have enough days that would cover most, if not all, of the employees that are actively working. And some of those days would be makeup days for those that maybe are coming off of leave of absence or out of the country, or whatever the case may be. That way we can focus on education in the departments, and give them what they need insofar as, equipment and any other kinds of education. I mean, ICU alone, I'm just going to pick on ICU. ICU alone has, I don't know, what is she up to, Brian? Is she still at 2 pages, 2 big old
3.
poster board? 3.
Yeah.
So, what we're doing now is it might be working for a very small subset of what we need, but it's not working overall. So that will change. I'm not sure exactly when we're going to pull the trigger, so to speak, or etch it in stone, but that is what the overall is looking like.
Perfect. Thank you for that update.
You're welcome.
Okay, education more broadly, again, to compensate you for either brick and mortar institutions, conferences, certifications, you have the EdAssist fund that is provided by the organization, and then the education fund by SEIU. I've utilized both of these in the past. If you have any questions about how to navigate their websites, I'd be happy to help. I know that we have had some of these tackled already by Danielle. I think Carrie said that she's interested and is going to be offsetting some of her certification costs using EdAssist as well. But if you run into any snags, I'm more than happy to help you guys out with that. Also tagging on to this generally, I wanted to make mention of, for the benefited staff, you have CET time probably left over in your bank. You can find out how many hours you have left in team. I would encourage you to start submitting those now, because those hours do not roll over into the new year. If you don't use it, you lose it, and then you get a brand new allotment for 2025. The deadline is the last pay period in December. So if you have it, please find some CEUs and turn it in for hours and credit. This came and went, actually, the education fair, so sorry about that. Moving right along. Unit-based practice council. Unfortunately, Carrie is not on, neither is Danielle. Carrie will be on our night shift department meeting. I will leave it to her at that time to give us some updates. Scanning scores still are great. Please continue to do what you're doing. This is something that I audit daily, and if there are any points where there are patterns of behavior that are observed, I talk directly to individuals, but overall, we're doing a great job. Just, this is a patient safety issue. And it's all, it's the right thing to do. And you guys do it consistently. So thank you. All right. So with a very heavy heart, I have to make the announcement. Our per diem staff members of ART has picked up a full-time benefited job at our sister facility at Mercy General Hospital. Her last day will be November 23rd. And I'm currently working with HR to push through her replacement position, which will be a nighttime per diem position. So she obviously was a rock star. She's going to do great things over at Mercy General. But with that said, if you know anybody that is interested in working in the fast-paced community of respiratory therapy at Woodland Memorial, let them know to keep a lookout on our job postings board, as it hopefully will be posted, if not by the end of this week, beginning of the next. And productivity, again, to circle back to this again, I just wanted to touch base with you. I'm in constant communication with our directors of finance and our CFO to ensure that our billing practice is correct. The change in our billing practice is correct, and from everything, from all of my consistent talks with both of them, the answer that I get is that it is complicated, but they have not given me any direction to change what we are doing. So for as it stands right now, we're going to continue with this updated billing practice that you have all been doing thus far. When, if, and how I get different direction, obviously I'll immediately cascade that down to the department and we'll make adjustments. But as it stands for right now, what we're doing is still fine. Kudos. So there was a deluge of kudos during RT week. This was to facilitate the raffle tickets. So thank you all for recognizing each other for all the work that you do, which manifested in our raffle selection earlier in this meeting. However, there was one kudo on the board again for Zavart. Thank you, Zavart. Good catch. Pulled an old pill out of a BiPAP patient's mouth. That is phenomenal. Typically we look to make sure that patients swallow their pills. Sometimes it gets caught in their cheek, but that definitely could have been a aspiration choking hazard. So very good job, Zavart. There is something that was on our kudos board that I think I have an idea of what means, but I'll ask the group now. It says we need to get some O2 tank keys. Now, for those that are on the call, do we happen to know what that is in reference to exactly?
Maybe they meant the home O2 tank key, for discharge, Brian. We don't normally do it here, but at Sutter, yeah, we do it often. I don't know, some of us meant by that.
That was Mike Falloon who wrote that up there, and yeah, he's had patients bring in their own home O2, and we don't have any extra tanks lying around, and he needs to help set them up. So yeah, we just need some, I think we even joked saying we'll just, or you can order them on Amazon for like nothing, so.
Yeah.
Just
so
to
these-
individually have some, you know.
I think
These-
clinical engineering should have like a few of them. I think, right?
I don't
Well-
know that they may not. But these are
don't know what
the
it is.
ones that we have in house don't have we don't crack the tanks. These are the ones that have the regulators placed on them, I'm assuming.
Yeah.
Yeah. So yeah, we can order those. I wasn't clear if this was in reference to our tank bank outside because we have those keys, but okay. So
No, it was literally for tanks and the ones with the regulators, like we have them in like L&D because all of our warmers, we have to crack the tanks, but
Yeah.
those are
Got it.
attached to those, so we just need some ones that are just, hanging
Okay.
out so we can grab them and use them when need be.
yeah, we can absolutely order those for sure. Okay. All right. And thus ends our Halloween department meeting. Questions, comments, concerns?
Thank
Was
you
it
for
hap-
my cup.
You're
Happy
welcome.
Halloween to everybody.
Happy Halloween. And yeah, thank you for your time and attention. See you next month.
Bye,
Thank you. Thank
Bye.
you.
All right, bye guys. Thank you.
Bye.
Bye bye.